My name is Mark Campbell. I'm an orthopedic surgeon in Phoenix, Arizona. My subspecialties are lower extremity surgery, including everything from the hip down through complex foot and ankle reconstruction. SurgiSTUD has a couple of real options. The first is this in general practice for certain procedures. It allows you to work through a procedure, but using soft tissues and using deformities as opposed to just a simple sawbones. On the other hand, with the challenges regarding cadaver use, SurgiSTUD kind of answers all of those problems. The other place it's really attracted me is that if I have a very complex patient, I can actually get a model that matches their anatomy, and I can practice a procedure and identify the potential pitfalls of that procedure before I subject the patient to those same pitfalls. On the other hand, people might say, well, does the SurgiSTUD replicate what you'd feel in the operating room? And my answer would be, I think it does fairly closely. And cadavers don't replicate what we see in the operating room either. So the advantages of SurgiSTUD, not even mentioning the fact that there's no storage issues with it, there's no issues with the disposal. And at the same time, there's no issues with availability. A lot of things that are very advantageous compared to cadaver use. Also, if I want to practice a procedure and need to use a cadaver, I have to take time away from my practice. I have to travel down to wherever the certified area that I can use a cadaver is, and all those things need to be dealt with. With SurgiSTUD, I can take a break from my clinic during lunch and have the SurgiSTUD in my office, in the break room or wherever, and do the procedure right there. It comes to me, I don't have to go to it. When you look at the SurgiSTUD from the bone perspective to human bone, I think it's fantastic because it can be adjusted. The SurgiSTUD models can be adjusted with multiple different densities or changes in density, and so you can theoretically match patients you tend to work on, or even a specific patient. Now that cannot be done with cadavers. You get what you get. But the SurgiSTUD is amazingly realistic, and in reality, cadaver tissue itself is not realistic. So I don't think there's any real difference between the two as far as their comparison to human tissue in the operating room. I had a saw cut that felt identical to the patients in the operating room. And I've never experienced that before, not with cadavers, not with sawbones or others. So they can dial it in specifically. That can also be dialed in for certain deformities and certain conditions, so it can be adjusted. Just a huge advantage to SurgiSTUD is its ability to change in time for whatever is needed to be done. I think the ability to practice a procedure in a semi-realistic anatomic situation before going into the surgery is of paramount importance for a successful surgical procedure. I think there's no question of the value of this product. And again, all you need to do is compare to what the alternatives are. For instance, cadaver specimens. Cadaver specimens, you can utilize them to a certain point, but storage and handling limits their long-term utilization. The SurgiSTUD models you can use primarily, and you can use for other things to practice other procedures and stuff within the same model, and it'll last as long as you want it to. I think, again, when you talk about training with a SurgiSTUD is absolutely the best case scenario. I think it comes down to the same things, that it's not just how good SurgiSTUD is, because it reproduces anatomy, both general anatomy or patient-specific anatomy, but more importantly, it answers every single disadvantage that cadavers have. And I think that's the simple answer. The value is unquestionable with this product. There's one thing to note, though, compare it to sawbones. I don't think anybody will will say that sawbones are really that good in learning or practicing any procedure. Having just a sawbone is not realistic in any way, shape, or form. And I will say that sometimes trying procedures or things on the sawbones can even be detrimental. I think you really need to have the densities controlled. You need to have the soft tissues involved, and that's what the SurgiSTUD offers. Another area where this product can be very helpful is in product development. I've been involved in multiple different projects over the years, and one of the challenges is most of these projects have multiple people on the team producing them, and often those people are spread throughout the country or large geographic areas. It'd be very hard if you want certain members of a design team, for instance, to do a portion of a procedure on their own without bringing them all into a central location and using cadaver specimens. The SurgiSTUD could go out to those people, and it could be adjusted or manipulated however it was needed for that purpose and testing different product development ideas. So pretty much unlimited how it could be helped within product development. You know, I've been asked if it's important to have consistency in standardization in training of physicians, and I think the answer is obviously yes. So how is it done normally? Well, normally, if a surgeon wants to be trained in a certain procedure, a very standard way to do it is via cadaver training. So a surgeon may go to an area where they can use cadavers, and that's fairly limited in where they can go with that. But the one issue is there's no way to gain consistency with those cadavers. So you don't know what you're going to get. They may have pre-existing deformities, they may have none, they may be obese, they may be thin. I mean, there's just no way to give all the surgeons the same experience. With the SurgiSTUD, it's completely opposite of that, and there's a couple more advantages. Not only could you give every surgeon an identical anatomic model, you could go beyond that, and you can get every surgeon that gets an identical anatomic model with a pre-specified deformity that is made for that case. So you're not doing a procedure for deformity on a normal cadaveric knee, which is very unrealistic. You can actually do a case for deformity on a consistent model with that deformity.